When dinner kills. A family meal served up a fatal trap. 3 guests died. 1 survived, but only after an urgent liver transplant. Their host, Erin Patterson, was convicted of murder after serving up death cap mushrooms. I'm Dr. Matt, consultant paediatrician and content creator. I've treated poisonings, guided colleagues through ethical minefields, and am working to rebuild trust in healthcare. This case brings both hard science and hard choices into focus. Today, I'll explain how amatoxin disables the liver, why we can't reverse that damage directly, and why a doctor's post-verdict media comments may have breached professional standards. Let's dive in. Amanita phalloides, the death cap mushroom, contains amatoxins, especially alpha-amantin. These toxins enter the bloodstream and target the liver, binding irreversibly to RNA polymerase II, the enzyme every cell uses to build proteins. When protein synthesis stops, liver cells die, and the damage cascades. Amanita phalloides is the deadliest mushroom known to science. As little as half a cap can kill an adult. It's responsible for 90% of mushroom deaths worldwide, and has claimed victims ranging from ancient times, it's speculated that Roman Emperor Claudius was murdered by his wife this way, to everyday foragers. Here's how death cap mushroom poisoning progresses through 3 distinct phases. The latent phase, 0 to 6 hours after ingestion. Delayed onset of symptoms can be a big hint to include on doctor, but patients may not know the deadly path ahead of them and often delay seeking treatment. Phase 1, gastrointestinal phase, 6 to 24 hours. Severe vomiting, abdominal pain, watery diarrhea. If fluid loss is extreme, it can trigger hypovolemic shock. Phase 2, the hepatic phase, 24 to 48 hours. Patients seeing better, but damage intensifies silently. Liver enzymes climb, bilirubin rises, key markers to watch for. Phase 3, liver and kidney failure, 48 to 72 plus hours. Multiple organ systems crash, seizures, unconsciousness, brain swelling, death. Clotting fails, known as coagulopathy. Toxins build up in the brain, causing hepatic encephalopathy. Confusion, agitation, coma. These phases can overlap. In severe cases, organ failure can begin within 24 hours. Not every case reaches phase 3, but some deteriorate quickly despite every effort. That apparent recovery, it's a trap. People believe they're improving, while the toxin silently destroys liver cells. Critical treatment windows close fast, especially when poisoning isn't suspected. Unlike kidney failure, where dialysis can substitute, the liver has no mechanical backup. We can give clotting factors and fluids, but we can't replicate its many individual detoxification processes. That's why early recognition is vital. So here's what clinicians aim to do. Phase 1, remove stomach contents, administer activated charcoal, aggressive fluids to protect the kidneys. Phase 2, monitor liver markers and clotting, prepare for ICU escalation and early consultation with a transplant centre. Phase 3, support failing organs, electrolytes, clotting, fluid. Assess urgently for transplant. There is one antidote, but only if it's given early. Silibinin, a milk thistle extract, blocks amatoxin from binding to RNA polymerase II if it's administered before that connection is locked. It also prevents the liver from recycling the toxin, helping clear it from the body. But in this case, there wasn't enough. Doctors realized they'd need it for 4 patients. The hospital pharmacy didn't have the supply. Teams scrambled to source more from nearby hospitals, racing against time as symptoms worsened. Silibinin can save lives, but only if it's available, and only if it's given before the toxin takes hold. If we catch it early, we can slow absorption and protect the kidneys. If we catch it late, all we can do is support the body, wait, and hope for a transplant. Toxicologists tested blood, urine, and kitchen equipment. Amatoxin was found in the victims and Erin Patterson's dehydrator. DNA matched the mushrooms to Amanita phalloides. Patterson's own test, taken more than 51 hours later, showed no toxin. But by then, 3 people were dead. 1 had received a liver transplant. CCTV showed Patterson leaving the hospital against medical advice. She was, conveniently for her, uncontactable for a time. Later, she was seen at a service station, after which police were able to catch up with her. The timing meant that any trace of the amatoxin would have likely cleared, but not the suspicion. The liver performs hundreds of functions: detoxifying chemicals, producing proteins, regulating immunity, managing metabolism, and making bile. When amatoxin halts protein production, liver cells can't maintain any of those tasks. They die, and that failure ripples outwards. We can support the kidneys with dialysis. We can manage with clotting factor replacement. We can hydrate and rebalance electrolytes, but we cannot fully replace detoxification. Despite what some wellness influencers may claim, toxins build up, jaundice deepens, encephalopathy worsens. Eventually, multi-organ failure becomes irreversible. Transplant is the only chance, and even that depends on timing, availability, and clinical suitability. Plus, you've got to survive long enough to get there. After the trial verdict on July 7, 2025, Dr. Chris Webster, who had treated Erin Patterson, shared his thoughts in interviews with media outlets like the Herald Sun and BBC. Perhaps appropriately, he came across somewhat shaky when he described his initial suspicions, saying, I thought, okay, yep, you did it. You heinous individual. You've poisoned them all. He also referred to Patterson as a crazy and a disturbed sociopathic nutbag, reflecting his internal reaction during the hospital interaction. This wasn't just unprofessional, that was unethical. Patient trust depends on discretion, accuracy, and respect. Even when disclosure is legally justified by court order or public health law, we can only share what's essential. The right process is simple. Check legal requirements, consult hospital counsel, contact your indemnity provider, prepare a fact-based statement. Dr. Webster has now said he can no longer do media interviews. He's seeking legal advice, and his job may be in jeopardy. I wish he'd taken that advice before speaking, because once you cross that line publicly, it's really yours to uncross. As clinicians, we don't just treat disease, we model trust. When treatment is limited, trust is everything. This case reveals amatoxin's deadly power and the limits of medicine when no effective cure remains. But it also shows how ethical conduct matters as much as expertise. 3 lives were lost, 1 family shattered, 1 community shaken, and our profession's integrity tested. Medicine's hard. Ethical breaches make it dangerous. I'm Dr. Matt, paediatrician, content creator, fellow parent. Subscribe for more evidence-based guidance you can trust.